Good morning and welcome to our Mental Health and Behavioral Health webinar session on utilizing resources from the Texas Health and Human Services Commission to support student mental health. On behalf of TEA, we are really glad that you took time out of your day to join us. Before we get started, I'd like to hand it over to our new Director of Mental and Behavioral Health at TEA to introduce herself. Dr. Watson?
Good morning, everyone. We want to welcome you to our webinar today. I am glad to join the team, this mental health and wellness team here at TEA. You have a great support, and they have produced a great webinar for you today with information that you will be able to utilize. So we thank you all for coming today. I thank you all for welcoming me to this position. And as I bring a wealth of knowledge in mental health and also with counseling. So I want to thank you all for coming today, and I will stop talking so you can enjoy this great information.
Thank you, Dr. Watson. So in today's session, we're going to learn how to implement available resources from our Texas Health and Human Services Commission in order to strengthen school mental health systems. So these supports will include resources that address interventions for students, training needs for staff, and mental health promotion for the community. So today's session is going to be led by our colleagues at the Texas Health and Human Services Commission. So our hope today is that you can take something away from this session and then use it in your school community. So this session is being recorded, and the recording and the supported resources for this webinar will be posted on our schoolmentalhealthtx.org webinar following today's session. So as we start today, I want to remind everybody that before we end our session today, we're going to ask you to complete a post survey. So part of our mental health work here at TEA is funded by Project Aware Texas. And that's a grant through the Substance Abuse and Mental Health Services Administration, or SAMHSA. So our grant requires that we give a brief post survey after our training sessions. So we really appreciate your support with this requirement. And again, that won't happen until the end of the webinar session. So I do want to remind everybody that today's session is in a Zoom webinar format, which means participants cannot show their video or share their audio. So we will have time today for audience Q&A with our presenters. So to ask questions, please use the Q&A function, and we're going to do our best to get them answered. We will not be able to respond to the raised hand function. I want you to also to be familiar with the chat function that we have below. We're going to be adding some resource links into the chat for you as we get started, and then throughout our time together. At the end of the webinar, that's where you're going to find the survey that we just talked about. All right, so our last piece of housekeeping is a reminder that we will provide 1.5 CPE credits to educators for today's webinar for those who attend the whole session. So a CPE certificate will be sent within 1 week to the email address that you registered with. And this is the only way to get your certificate. So we will not provide a CPE from TEA for the recordings. If you did not receive your certificate, check in your spam or your junk folder, because sometimes it does get put there. So with that, sorry, Ashton. With that, I am going to pass it over to my colleague, Ashton, who's going to talk a little bit about how we meet into the mental health framework.
Yes, ma'am. Thank you so much, Tammy. I am really excited to introduce our friends here from the Texas Health and Human Services Commission coming up here soon. As our mental health and wellness team have had a chance to talk to folks and school leaders all across the state, one of the things we always learn and always hear about is that, school districts and the school mental health staff in those districts can't do it themselves. It takes a village to really have that multi-tier system of support for all of our kiddos in our state of Texas. And our friends from the Texas Health and Human Services Commission are going to do a really great job today of just showcasing some statewide and regional supports that are available to school districts and campuses. So I'm really excited again for our Texas Health and Human Services Commission colleagues to really showcase the resources that they have and the supports that are offered to school districts all across our state. And to really showcase that, I do want to talk about how today's session and the resources that our colleagues at HHSC will be sharing today, how valuable they will be for implementing the Texas School Mental Health Framework. And just a quick review of the framework, as we look at the schoolhouse, that represents that multi-tiered system of support approach to planning school mental health services and supports. And then as we take a journey down those steps and into those stepstones, those are the ways that we identify the key domains and practices for establishing a quality school mental health system. And then finally, as we take a look up into the clouds above that schoolhouse, those are the components or the areas of school mental health that was established by Texas Education Code 38.351. And that particular piece of statute requires LEAs to address each area of school mental health by developing practices, procedures, and professional development opportunities. And in today's session, the resources from the Texas Health and Human Services Commission, local mental health authorities, prevention resource centers, regional suicide support centers, and also various models implemented throughout the state will address the areas of school mental health circled in the clouds that you see there, and also the pathway to quality school mental health identified and circled within the stone. So again, we really are excited to have our Health and Human Services Commission colleagues come in and really share the resources that will support you all in implementing the Texas School Mental Health Framework. And now, without further ado, I will turn it over to our first set of presenters from HHSC, the Mental Health Programs and Children's Mental Health Team. They will discuss some available resources and models to support school mental health implementation.
Thank you so much, Ashton, Tammy, and Dr. Watson for having us here today. We're so excited to share some of these really important resources with you all. So just thank you all so much for being here. Give me a moment while I share my screen. Okay, does that look good, Ashton? Everything good on y'all's side?
Yes, ma'am, it's perfect.
All right, excellent. So my name is Sarah Fiorenza. I am the Systems of Care Director with HHSC with Children's Mental Health. So I'm going to kick us off today, but then I also have some of my amazing colleagues here as well that are going to walk us through some other resources. So I'll start off with the System of Care overview. Then we'll hear an overview related to some of the services available through our local mental health and behavioral health authorities. We'll hear a little bit about the TRR, Texas Resiliency and Recovery Model, a great overview of mental health first aid, and then a bit about our behavioral health partnership program overview. So as Ashton mentioned, tons of information and resources, and we're so excited to be here with you all today. So we're going to start in a little bit of a lofty place. We're going to talk a little bit about theory and framework. So some of you may be familiar with System of Care, but System of Care is really a national framework and philosophy. It was established over 25 years ago, and the key is really about transforming child and youth serving systems. So we all know that mental health challenges, they don't impact just one part of a child's life. They impact every aspect, and they also impact a child's family. We also know that comprehensive individual or family support cannot be obtained from just one place or just one source. And that is really why a system of care approach is so essential when we're talking about children's mental health. So when I say system of care, what I'm talking about is really this approach to coordinating efforts by all of the agencies, organizations that exist in a community, but also working directly with the children and youth that we're serving to ensure that services and supports are accessible, they're appropriate, and most importantly, that they lead to positive outcomes for everyone. Systems of care also have to be emergent. They have to be dynamic, and they really have to respond to a local environment. We've seen everything that's happened in the last 5 years, right? This is a different world than we inhabited in 2020. The the challenges that our children are facing are different. We've had the pandemic, we have social media. So part of that system of care approach is really being responsive to what we're seeing in our communities and really being able to adapt to that. Also, we support system of care because we know that it works, right? Again, this is a national framework. We have a lot of data. We know that it really decreases behavioral and emotional symptoms, decreases suicide rates, substance use, juvenile justice involvement. And what does it do for us? It increases school attendance, it improves grades, it creates more stable living situations. Families report reduced caregiver strain, improved family functioning. So we know that this works. So at the foundation of the system of care approach is really these values: family-driven, youth-guided, and community-based. So families are really at the heart of a system of care approach. So we know that supporting strong family relationships is really key to child serving systems that work well. Parents, guardians, caregivers, the insights of these individuals really need to be front and center in every aspect of a system of care. And that really even includes policy making when we are putting together the design of a program, when we're delivering services. We really want to center the voices of families. The same with youth. Youth voice is also fundamental. Authentic youth engagement really allows youth to be more directly involved in the services that they receive. And we know that it really allows youth to have a say over what happens in their own lives. But it's also a two-way street, right? It also benefits communities because youth and young adults have really important information about the services and supports that they've received, what works, what doesn't work, and to be able to feed that back in and then, really be adaptive and improve those services and supports. That really benefits everyone. So really acknowledging that family and youth are really experts in their lived experience is really central to our system of care approach. And then finally, community-based, right? We all know that we want to be able to support children and youth within their own communities. That's always our goal. Oops. Next slide. So then you'll see here really similar language. The purpose and goal of our system of care. We really want to ensure that all Texas children and youth have access to high quality mental health care that, again, is family driven, youth guided, community based, and sustainable. And the goal is, how do we strengthen the collaboration both at the state and the local level to ensure we have a really robust and seamless network of systems and supports that work for children and youth? Okay, so now kind of a little bit on the wonky side, but important to know that system of care is actually in our state statute. So we have a statutory framework that essentially says that we should implement system of care at the local level and that we should work across the child serving agencies to really do this work. And then you'll see here in the next slide, oops. Sorry about that. We have a memorandum of understanding across all of the child serving agencies. So Health and Human Services Commission, Department of State and Health Services, Department of Family and Protective Services, TEA, Texas Juvenile Justice Department, as well as TCOME. So all of us working together to really ensure that we are incorporating the system of care values and framework into the work that we're doing as we're serving children and youth across the state. So now kind of coming down from that lofty space, talking a little bit more about what are we doing now in schools and talking a little bit more about some of the services that we are able to provide. I wanted to talk to you all a little bit about a grant that we currently have from SAMHSA. So as I mentioned, we have the state statute, but we don't have any state funding for this work. So we've been really strategic, and we've been able to get some grants from SAMHSA, the Substance Abuse and Mental Health Services Administration, several iterations of this grant over the last 10 to 15 years. The current grant that we're working on, as you'll see, it started in 2021. We have about 6 months left, but this grant has really been focused on increasing access to school-based mental health services, and including youth peer and family peer support. So we work closely with the Texas Institute for Excellence in Mental Health at UT, TimeH. And then we've also partnered with 3 local mental health authorities. We partner with Integral Care, Emergence Health Network, and Pecan Valley. And then they have developed memorandums of understanding with schools in their district. So Integral Care works with Maynard, Del Valle, Pflugerville ISD, Emergence is working in Conatillo ISD, and then Pecan Valley is working in Poolville, Weatherford, Millsap, and Springtown ISD currently. And what that looks like is these school-based teams have really worked with the schools. They've developed a referral pathway, and then they're able to provide services and supports on site within the school. And that can just be really helpful for students to have that counselor that's there, the school-based interventionist, and to be able to receive these peer services as well, has been really, really impactful. So, and then if there are needs that exist that the school-based team is not able to meet, they're able to refer to, within the community to make sure that they're able to get those needs met as well. And then at this point, our goal is to serve 375 children and youth. At this point, the data is there's a little bit of a lag, but as of the 3rd year of the grant, we had served 224 children. And then we have seen positive outcomes. So for the data folks out there, we use information from the NOMS, that's our National Outcome Measurement Survey. That's something that is required by SAMHSA. And then we also use the Pediatric Symptom Checklist. And then just a little bit more about the peer supports that are provided. As I mentioned at the beginning, really this idea of youth voice, family voice, how do we ensure that the work that we're doing is really youth and family guided? And peer support is one piece of that. So that was something that was really novel about this grant, was being able to provide team-based care within the schools, but to include the certified family partner and the youth peer support specialist. And just to clarify on the youth peer support specialist, I think sometimes people can hear that and be a little uncertain what that means. When we say youth peer support, it's a young adult, and they are providing peer support to the child or the youth within the school. But they are an individual that identifies as having mental health challenges and are really able to support the person from that perspective. So this isn't clinical. It's really this idea of being able to talk to somebody that's really relatable, where they might not always feel comfortable talking to the counselor or the therapist in the same way. And we've seen that the peer relationship can really help impact kids, because it's just something that they don't really have otherwise. So we were really excited that we were able to include this in our grant. And again, it's very much aligned with our system of care values and approach. So moving on from there, I just also wanted to talk about 2 quick things that we also are able to do through our grant. So we have something called Children's Mental Health Acceptance Day. So May is Mental Health Awareness Month, but we also really like to commemorate Children's Mental Health Acceptance Day. We have an annual event that we hold in Austin. We have one coming up on April 26th for any of you all that would like to attend. It's at the Boys and Girls Club of Austin campus. It's from 10 to 1. I can also share the information after. But it's really just a way to create creating awareness, helping to eradicate stigma, and really just create some positive feelings around discussions related to mental health, as well as providing resources in the community to families that could benefit from them. And then similarly, we're able to have our mental health creative arts contest. Some of you might be familiar with that. It's just a really beautiful thing that we're able to do. It just closed, so it closed on March 1st, but this is something that we do every year. It opens on November 1st. So any way that you all, as districts and schools, can really amplify that, we would love that, because again, this is just a way that we really help kind of raise that awareness related to mental health, and get rid of some of that stigma, so that we can feel, kids can really feel comfortable talking about some of these pieces. So that's something really special that we're able to do. And I think that might be my last slide. Alrighty, so I'm going to go ahead and turn it over to Will Terry, our Children's Mental Health Director.
Sarah, I appreciate it. It's a pleasure to be here with everybody today. My name is Will Terry. I'm a clinical social worker, and I'm the Children's Mental Health Services Director. And I'll be talking to all of us today about local mental health authorities, local behavioral health authorities, and the Texas Resilience and Recovery Model of Care. So we'll start with this slide, which just gives a brief overview of kind of core LMHA services and kind of their target population. As an aside, LMHAs, or local mental health authorities, also sometimes they're referred to as community centers or local behavioral health authorities. They act as essentially political subdivisions of the state, and there's 39 of these local mental health authorities / local behavioral health authorities as established in state law. The responsibilities are kind of twofold. They are responsible for planning and coordinating mental health policy and resources in their catchment areas, and sometimes at a state level. And they also are designated to serve as a provider of last resort for community mental health services in their regions. Typically, the LMHAs and LBHAs do this by contracting with providers and coordinating with multiple entities, including schools, federally qualified health centers, and sometimes law enforcement agencies as well. If we could go ahead and go on to the next slide. When it comes to eligibility, this is kind of what's set forth in our eligibility determinations: meeting financial criteria, which is based on the being within a certain percentage of the federal poverty level, and also then qualifying for services as determined by the uniform assessment process. All right, we can go to the next slide. This is a handy map that shows the different regions that the local mental health authorities are responsible for. So any youth or adult who's in one of these regions who is seeking public mental health services could access one of the local mental health authorities, reflected in this map here based on what's in their region. So for the region where I live, you can see which mental health authority covers Travis County, which would be in rural care. All right, if we could go on to the next slide. The TRR model, or the Texas Resilience and Recovery Model. So this is the delivery system, assessment system, and provision of service system that the state uses for delivery of services. It's a framework for establishing eligibility for receiving services. It's also a framework for providing a recommended level of care, and also for HHSC to deliver guidance about how LMHAs and LBHAs make a level of care determination. Part of the TRR model is dependent on what we call the CANS, or the Child's and Adolescent Needs and Strengths Assessment. This is typically delivered every 90 days, and it helps inform the clinician and the clinical team providing the kind of intake or update assessment as to what level of care might make sense, and then they utilize their own clinical judgment and insight to make a final level of care recommendation. It does require certification and standardized training to administer. This process, which is part of the TRR model of care, does kind of rely on gathering some basic information, such as the reason for presenting for services, demographic information, family history, early childhood information, risk assessment to help determine if crisis services are needed, and it does include, clinical, personal, and historical questions about a child, about a family system, about symptoms. So it's something to take into consideration, that it does involve the disclosure of what could be, personal and activating information. So just some information on the front end about that. If we could go to the next slide. So this very busy graphic shows the different levels of care that are within the TRR model for youth seeking services at a local mental health or local behavioral health authority. There's a fairly wide range of levels of care, and the kind of uniform assessment process that I was talking about earlier helps clinicians get a recommendation based on clinical thresholds within the assessment as to what level of care might make sense for the youth receiving services. And different levels of care within the system have different contractual performance requirements within HHSC, so they have performance metrics that are geared around the type of symptoms and the type of population that's intended to fall into each level of care for treatment. So it's a very busy graphic, but nonetheless, I think it does a pretty good job of capturing what would be considered the continuum of services that's available within local mental health authorities. That being said, this graphic isn't exhaustive and doesn't cover the entirety of all mental health services provided by LMHAs. There are many services that they provide that are adjacent to HHS contracted services or run in parallel based on other interlocal resources like city or county resources. All right, I think that's it for this part of the slide. I'll go ahead and pass it on to our next presenter. Thank you.
Thank you, Will. Good morning, y'all. My name is Jandela Font Garcia, and I am the Mental Health First Aid Coordinator here at HHSC. And so I'm going to be talking to y'all about mental health first aid today. So mental health first aid, much like CPR, is an evidence-based training. And it teaches participants how to recognize signs and symptoms of mental health and substance use disorders. And so we might think of mental health first aid similarly to just regular first aid or CPR, and that is the initial help given to people when they're struggling, in this case with mental health or substance use concerns. The program builds an understanding of impact, and we talk a lot about stigma and how to reduce stigma throughout our communities. That's a big part of the program. We also review common treatment, so what type of treatment providers are out there and what type of treatment is available. Sometimes it's self-help skills or support groups, and we also talk about kind of more professional help services like therapists and psychiatrists. I see a comment that somebody really liked the youth mental health first aid course. So great. I'm so glad to hear that. Mental health first aid does provide a 5-step action plan to follow. And that's sometimes what makes it different from other programs, because we're telling you exactly what to do in certain situations, different things to say. And we'll talk a little bit more about that in a little bit. And our goal is really to make sure that our communities are happier, healthier, and safer by getting as many people trained as possible. Because if somebody is struggling in your home, in your faith community, at your job, we want them to have contact with somebody who's taken this program and knows what to do and how to support them. So that last bullet is written a little bit lengthy, but the goal is to have as many people trained as possible so people in the communities have support. You can go to the next slide. So mental health first aid started in Texas in legislation in 2013. So that legislative session, they put it in statute, and we started our first trainings in 2014. So actually last year, we trained 40,325 people in mental health first aid. It was the most people we've ever trained, and half of that were from the school districts. So really excited about how it's impacting the schools. HHSC contracts with all 39 local mental health and behavioral health authorities to provide mental health first aid. And there's 3 different curriculums that we provide. So there's the adult curriculum, and that's for adults, so people 18 and older. And they learn how to support other adults who are having mental health or substance use concerns. Then there's the youth mental health first aid course, and it teaches adults how to support children and youth. So this is a course, somebody said they took it in the chat. The youth mental health first aid course is for people like teachers and other people who work in schools, who work with youth, so they can support youth better. And then there's a teen program, so I don't want to mix it up with the youth. Teen mental health first aid teaches students in high school or ages 14 to 18 how to support other teens. And this is the newest program. What's unique about it is that it does emphasize the importance of including a trusted adult, because we don't want it all on the teens. We know it's a lot to support somebody who's struggling. And so in order for your organization, agency, school to offer teen mental health first aid, adults, some of the adults there have to take the youth program to make sure we have those trusted adults on the campus and the agencies, etc. Next slide, please. So let's talk a little bit about how mental health first aid is different from other mental health training programs. I do want to mention again that it is an evidence-based program. There's lots of research that has gone into showing that this is an effective program, that it works. It's also taught by a live instructor. So there's 3 different ways you can take mental health first aid. You can take it completely in person, you can take it completely virtual, or you can take it in a blended format. If it's virtual, it's like this, like over Zoom or Teams. And so you still get the opportunity to interact with a live instructor, have your questions answered, get some feedback, which makes it different than just a module-based training. And it provides hands-on experience through real-life scenarios. So we're practicing different scenarios and things that we might say and do. We're practicing that 5-step action plan. We're practicing those really hard things like asking, are you thinking about killing yourself? And that way you're practicing it in the class and you're saying these words before you're out in the world having to say them, because it can be really uncomfortable. So we're giving you that opportunity to practice it in a really safe space. We also provide resources in your local area. So when you take the class, your instructors will provide you with a resource sheet or a packet that goes over what mental health and substance use resources and self-help resources are available in your community. Because part of the 5-step action plan is supporting people to get treatment if that's what they need. So you need to know what's available. We're not expecting you to go out and research this yourself. And we also go over like national resources, but I think the most important part is that local resource sheet. And then it provides a 3-year certification with a manual. So after you finish the course, you are a mental health first aider. You have that certificate for 3 years. It looks great on your resume. Sometimes people look for that. And then I'll also mention, if you're in Texas in the school system, you can get double CPEs for taking mental health first aid. So when any of the face-to-face interaction, so the in-person course, you get double CPEs for the total amount of hours. In the virtual course and blended course, it's for the amount of time that you're interacting with a live instructor. And then you also get like the single hour CPEs for the online portion, which is about 2 hours. And then the in-person or live like this, you get your double CPEs. I'm a therapist. I have to get CEUs. I know how hard it is to take time off and get those. And so to get double CPEs, I think that's so important to mention. Next slide, please. So why is the youth version in particular important? Since I know that y'all work with youth, we're going to talk about this a little bit. We know that substance use starts really early in adolescence or young adulthood. Oh, I lost my slides. So early intervention is critical. We know that the earlier somebody gets treatment, the better the treatment outcomes. And so we want to intervene and give that support as early as possible. We know about half of US adolescents, which is a lot, have struggles with mental health. And so again, we want to intervene as early as possible. And because we're not taught in schools like what to say, how to approach mental health, it's good to have those words to learn about that. Suicide is a leading cause of death among adolescents, and we want to learn how to recognize those signs and symptoms, as well as practicing, like I said earlier, the hard questions. Are you thinking about suicide? Are you thinking about killing yourself? And the importance of asking those questions. We know youth, especially young youth, can lack the vocabulary and they don't really know how to explain what's happening. We might hear that they have a stomach ache when really they're experiencing anxiety. And so we want to learn what else to be looking for. And then sometimes it can be difficult to distinguish between what's typical adolescent behavior and what is indicating a mental health concern. We were all teenagers once, right? And so we remember at some point when we're teens, our parents become not cool. They're not cool at all. So we might isolate in our rooms from them. We might not want to talk to them, hang out with them. But that's pretty normal. Now, if you have a teenager who's also isolating from their friends, not engaging in hobbies or activities like they used to, then that might be something we need to look deeper into. And so for those of you that are at schools, y'all are in a unique situation to see these adolescents in their social environments and to be able to see some of these signs that they're maybe needing some more support. You can go to the next slide. And then one more thing that I do want to mention is that I'm sure a lot of y'all have heard about House Bill 3 from last legislative session. And the requirements are that school personnel who work regularly with students take an evidence-based mental health training program. So mental health first aid meets all of those criteria in the House Bill 3 rules. So I just wanted to mention that as well. And if you want to take a class, if you're interested, you can contact the mental health first aid outreach worker at your local mental health or behavioral health authority. On this slide, you'll be able to click a map and it'll open up, show the state of Texas. You can click on your county and see who your outreach worker is and email them or call them. They are the most passionate group of people I've ever worked with in my entire life. They really care, and they will be happy to talk to y'all about how to get registered for a class. So thank y'all for listening to me today, and I'm going to turn it over to Yvonne next.
Good morning, everybody. My name is Yvonne Rivas. I oversee the Behavioral Health Partnership Program. This program was created to bridge the gap between the local mental health authorities and the school districts. My staff are located at the educational service centers, and they are employed through the local mental health authorities. If you can go to the next slide, please. Okay, so the goal of the Behavioral Health Partnership Program is to promote the best practices list in the statewide resources rubric. They want to increase the educational service center and school personnel's understanding of mental health and co-occurring mental health and substance use disorders. The BHPPs do assist with implementing initiatives related to mental health and substance use. So they do partake in events like Red Ribbon Week, Mental Health Awareness Week. They go to counselor symposiums, parent presentations, back to school nights, really anything that the school has available for them to discuss their resources and the trainings that they provide. They're more than happy to be a part of for the ISDs. And so additionally, the BHPPs ensure that the school personnel are aware of the best practices, public and private, and all of the mental health and substance use resources and programs in your areas. In addition to, you can leave it on that one. In addition to providing resources and access and support, the liaisons also provide and are required monthly to provide mental health first aid, trauma and grief for the intellectual developmental disabilities population, and substance use prevention and intervention trainings. So that is 4 trainings that we're required to provide for y'all, for the districts every month. The liaisons are able to travel to the campuses and communities to provide these trainings and any trainings that the districts are requesting. Our program is unique in that we get to create our own curriculum or any curriculum that you're asking for. So if there's a need that the school is having, our liaisons are able to get that information and bring it back to the district. And all of the trainings provided by the liaisons are provided for free. So there's no charge for using our program at all. The exception of that is mental health first aid. So we do partner with John Dell's team to provide mental health first aid for free. Funding is not always available. So that would be something that we would need to check in with her team before to make sure that funding is available. So I just like to give that caveat, but all the other 3 trainings will be free to your districts. Okay, now you can go to the next slide, sorry. Okay, so in these next slides, you can see what LMHAs are servicing your area by the ESC number. I'm not going to read them all, but you can see that one is Tropical of Texas, two is Nueces, and then you can see to the right of that, the additional LMHAs that also serve that catchment area. And so this is how you would know what LMHA you need to reach out with to contact your Behavioral Health Partnership Program liaison. And then you can go to the very last slide is just how to contact the liaison. I will also put the email for the state in the chat. Because if you send an email to the state, I'm also happy to connect you guys to the liaison in your catchment area. So I will add that now. Okay. And so I flew through that only because we're on a time crunch. But John Dell went through the mental health first aid piece, so I didn't really need to catch that whole thing. But that is it for my section. Yes, I'll give it back to Ashton because I think we're transitioning to a question space.
Yeah, thank you so much for that, Yvonne. And I know, like you mentioned, you had to kind of speed through it a little bit, and I'm hoping we might be able to catch some of that information in our Q&A time together. But otherwise, I think phenomenal job with the presentation from you all. Super excited for this Q&A time with everyone. So for the audience, what we will do, we have some questions from our team to ask our colleagues from HHSC. But while we are doing that, if anything comes up in terms of questions that you might have, please use that Q&A function because we will be sure to have some time right after this particular discussion to address as many questions as we possibly can as well. So I am actually going to start off this first question with you, Will, if you're still there, my friend. Oh, I'm sorry, let me back up. I actually started this off with you, Sarah, just related to the System of Care Initiative. So I know one of the things that you mentioned, right, is that the System of Care Initiative is something that is written in statute, right? It's something that is, in terms of the framework and the model, is something that's done, across the state as well as across the country as well. And then you mentioned a bit about the funding model and utilizing some federal resources to really support some specific school districts and school communities. And one of the questions we have here, right, is just acknowledging that not every district that's represented on the call today will probably have the System of Care grant to support their school communities. So we just wanted to ask a question really related to that, right? So how can other districts that might not be a part of the federal funding for System of Care, how might they be able to get started with implementing some of the components of the System of Care model within their own school communities?
Yeah, thanks so much, Ashton. And I think that's such a great question. So I think one of the places where System of Care can be a little confusing, and some of it is the way, as I mentioned to you, we don't have state funding, so we are able to leverage some federal funding. But sometimes it creates the idea that System of Care is a grant. When really, like I mentioned, the most critical part is the framework and the values. So you're right. We're able to use this federal funding to provide these very specific services within the districts where we have contracted with those local mental health authorities for this 4-year grant. But you're right. It's so much bigger than that, right? I think one of the first things I shared about the framework was we know that comprehensive support for mental health cannot be found in just one place. So again, it's really about how do schools connect with the community resources that exist? How do we really build out that network of services and supports? How do we really center the voices of family members, of youth, right? I think that's something that can really be built into any sort of programming that goes on at a school. And then further thinking about the community organizations that exist, there are many that provide family peer services, that provide youth peer services. I know there's LifeWorks here in Austin. I know, NAMI Texas Parent to Parent provides some virtual parent support groups. So really kind of helping create some of those connections to a lot of those resources that exist in the community. And then maybe there's an opportunity to do, an informal youth peer group or an informal parent peer group, right? I think sometimes we can get bogged down, thinking about if it looks a certain way, but it doesn't have to be something even that big or that official or formal. One of the districts where we work, we had some youth who really kind of self-organized, and they were creating this app for mental health, and they were doing this peer-to-peer support that they just kind of came up with on their own. So I think just kind of thinking about who in the school or in the district is already really motivated in doing some of this work, and maybe there's a youth and there's a family member that's already really active, and we can just kind of tap into some of those pieces. So yeah, it's kind of a big answer and maybe still a little bit abstract, but again, just kind of thinking about how we can really pull in those values to all of the work that we do.
Yeah, no, thank you for sharing that. And I think you did a really great job, right? I think a lot of our LEAs and school leaders on the call today, knowing that the system of care is a really strong evidence-based model will give them a place to start, right? As they think about how to pull together not only the resources within the district, but also the resources available throughout the community as well. So thank you for sharing that. And the next question will be for you, Will, really as we go on to that point, right? Using our resources within the community. You talked a lot about the local mental health authorities and the local behavioral health authorities, and also that TRR model, right? That Texas Resilience and Recovery model. And it was a phenomenal job of kind of laying out the different resources available through that chart that you shared. I know a lot of our school districts, currently work, whether it's informally or formally, with their local mental health authorities to provide some resources and supports to students and families. And one of the questions we want to ask and kind of have a little bit more clarity as well is, when would it be typically appropriate for a school or a campus to refer a student to their local mental health authority or behavioral health authority?
I appreciate the question. To make sure I understand, the question is, when would it be typical or appropriate for a school or school staff to refer a youth to LMHA, LBHA? It's a good question, and I appreciate it. When I think about the types of individuals who come into contact with an LMHA, the pathways that they typically take, that may mean that they intersect with the LMHA through the crisis hotline as a walk-in visit or through a referral from a community partner, of which among the community partners that LMHAs are interact with frequently are school districts. Also, in addition to that, jails as well. But for the purposes of this call, we'll be referring to the school district referrals. So school districts can make referrals to any of the local mental health authorities, or they can provide information to a family about the location, the contact information, the typical services that are provided through their LMHAs. But as far as like, how do you identify a youth or a family who might be appropriate for a referral from a school? For myself, I point to what is typically understood as the definition of serious emotional disturbance, or SED as we refer to it, I guess, here at HHSC. And that is to consider serious emotional disturbance, those are those youth who have a diagnosed mental, behavioral, or emotional disorder in the last year that results in functional impairment substantially that interferes or limits the child's ability to engage with their family, their school, or their community activities. So if you, in your school district are seeing that there's a youth whose mental health, behavioral health, or emotional, I guess you could say, symptoms are creating significant functional impairment in their ability to participate in school, that would be a youth who might meet the definition for having a serious emotional disturbance. And those would be youth who would be appropriate to refer over to the local mental health authority if the families want to seek services from a publicly funded provider. Of course, families could elect to seek services from any private providers or any other available public providers, but the LMHAs, the LBHAs are one of those types of providers who can serve youth, who meet that definition of having a serious emotional disturbance, and for whom the school as a referral source sees that those symptoms are interfering with their ability to engage meaningfully in school. On top of that, there are levels of care within, the LMHAs whose service rate is specifically designed to treat youth who are at risk of adverse consequences from school, such as expulsion or other issues like that. And there are some of the levels of care within the TRR system are specifically targeted for youth who are in that risk category. And so a lot of the framework for how the levels of care are intended to treat youth are built around what you might see in a school system, such as those youth who are at risk of expulsion from school or other adverse outcomes. So I hope that answers some part of the question, but I'd be happy to provide more detail if necessary.
Yeah, no, that was strong, and I'm pretty sure it answered the question pretty well, right? Just knowing that the local mental health authorities can be a part of that referral pathway, right, or that resource map that a school or a district might have for kiddos. And also exciting to know too that there are different levels, right? It's not necessarily just for some of the most intensive cases, but it can also be used for interventions on as it relates to school discipline and all of that good stuff as well. So thank you for sharing that. I do want to again remind the audience that if you have any questions for our panelists, you can use the Q&A function. I have one more question, and then I'll bring on Tammy to share any Q&A coming from the audience or the rest of the team. But this one will be for John Dale and Yvonne. Y'all talked pretty extensively about mental health first aid, and then also I wanted to acknowledge, right, that the BHPP liaisons are a resource as well for helping school districts, at least identify some strong resources to provide youth mental health first aid training to meet that HB3 training requirement. And so I know in our conversations in the past, we have had some really strong implementation and strong examples from school districts working with their local mental health authorities to provide that training to their staff, and sometimes even training up the whole staff in one professional development opportunity, right? And so this question is really for both of y'all, and if y'all can share just at least one or two examples of some school districts or local mental health authorities that have partnered to really provide some strong supports for getting their staff trained in youth mental health first aid.
Yeah, I can answer that one. So I am really excited about all the work that's been done this fiscal year. People are really taking the opportunity to get trained in youth mental health first aid. So one example is Brazos Valley trained College Station ISD in a 2-day period, and they trained 1,308 people, so 1,308 people were trained over 52 sessions, and 8 LMHAs came together to make that happen. And then there was also Permia Care, who trained Ector ISD. And according to the National Council, who owns the mental health first aid curriculum, it was the largest one-day training ever in the United States by one organization. And they trained somewhere around 1,500 people. They had other LMHAs come out to help. They had national trainers from the National Council of Mental Wellbeing come out to help. And so we are recognizing and that schools need this training, and we may have to work with each other from around the state. It may take some planning. Let us help you plan. Please understand, everybody is working on getting that 25% train this year. So we have some funding, but it's limited. So we are doing our best to help everybody get that 25% met. So if they can't do 100% of your staff this year, they are willing to make a training plan with you for next year and the year after to get that HB3 requirement met. So the MHFA outreach workers are so happy to work with the school districts in making that plan, whether you need to train 25 people, 100 people, or 1,500 people. Let us work together to do that.
Thank you for sharing that, Jonda. Yvonne, anything you might want to add?
I was also just going to piggyback on what she said. I had some liaisons that were part of the Isleta ISD. They trained the entire staff, like all the staff in that district, also in a 1 day period, like I believe last quarter. And so um, just us working together is really helpful. And we're hoping to be able to provide these big presentations and trainings to everybody, and get as many people who are certified to come and present these trainings. And so just to piggyback what she said, please reach out. We're happy to help plan it, get the staff together, bring in other LMHAs, and hope that we can help you guys meet this House Bill 3 requirement as well.
Awesome. Thank you all for sharing that. And I think the name of the game or the theme shared with that one, right, is that school districts, you don't have to do it alone, right? You just heard Jondell and Yvonne talk extensively, right, about just being open and welcoming to helping you plan, implement those strategies to provide that youth mental health first aid training. So
Yes.
before we
And then
get
Ashton, I was just going to say, I think there's a lot of like, because of the time crunch, I think a lot of people are like, we need this right now to just get this out of the way. Like we still have 3 years, like to 2029 to get this requirement out. So we're going to be here for that time frame. We're going to have support. And so like, don't panic. Like TEA knows that we're all trying to get this done. And so I think just know that funding will be back in the bucket in the next fiscal year. And so we'll continue to push these trainings out as much as we can.
Yes, ma'am. Thank you for that. And before we move on to our next set of HHSC presenters, Tammy, I think we have time for maybe one or two questions from your Q&A. And I'll just go ahead and pass it over to you before we get started with the next set of presenters.
All right, I will combine it into one question, but the question is, sometimes these districts may think that, okay, these are state programs. Yes, it's easy to get in bigger schools, those kind of things. Can you talk a little bit about or give an example of how rural school districts have utilized your services? And then to wrap in another question, it was more of someone had asked a specific population about like Head Start or things of that nature as far as accessing the training and stuff like that. So I want to throw that out there. Any examples of working with rural USA or also to kind of special programs outside of your traditional ISDs?
At least for mental health first aid, I can say like in the Hill Country area, that mental health first aid outreach worker, I believe she covers the most miles in the state, and she will drive from one end to the other end to the most rural and frontier areas of her county. I know Center for Life Resources, I believe, has some frontier counties, and they're doing training out there. So at least for mental health first aid, contact your mental health first aid outreach worker. I'll link the map again in the chat, and they will go where you need them to go. I can't always promise that funding is available right now in this moment, but they will work with you on a plan and do their best, and they will work together regionally and across the state. I have folks from North Texas saying, y'all need me to go to South Texas, I'll go and help you train. So they are a great group, and I highly recommend you reach out to them to come up with a plan. If you're in a rural or frontier, urban, suburban area, they are willing to help.
And then for my team does send out a lot of monthly newsletters or updates or upcoming trainings and things like that. Because my program isn't required by the districts to partake, if there's not any response, they're not going out. And so I think a big part of us coming here today is to also just discuss, like, when you guys reach out to me or to the liaisons, they will respond. I think it's just sometimes they only have so many contacts from the ESC that they're distributing that list to or distributing those resources to. And so similar to John Dell, my team is able to travel. We cover their expenses to travel. Like that's part of all the contract stuff that we do with them. And so they're more than happy to go out. I think sometimes it's just certain rural areas or certain districts are just not responsive to us, or maybe it's where those newsletters aren't maybe just not getting in the right hands of the people who know how to utilize our resource. And so that's something we're working on continuing to push out and just get as much awareness of what our program is and what it does out there. And then I think your second question, Tammy, was about Head Start and partnering with other programs like that. we kind of do that on a request basis. I think we have a ton of requests to be in the schools. So if anyone from Head Start or any of those other agencies is on here, providing support to the parents is still assisting the students. And so if there is any parent presentations that you have, or you need support in presenting those presentations to parents about students, we're happy to go out, and I would just need to know what area that's in. And so please feel free to reach out to me directly, and I'm happy to connect you to that liaison. But they do trainings at like Head Start. I know that they've gone to some domestic violence survivor like cottages and stuff, and done trainings there. So really my staff is happy to integrate and to make this program be accessible to more than just the schools in ESC. They want to help all the people that are supporting students. And so however we can do that, we're happy to help.
Great. Well, thank you all so much for taking the time out. Of course, you know, we will have our next set of presenters from HHSC, but I think you all have shared some really awesome insights for our folks on the call today to consider. And so now, without further ado, I will turn it over to the Prevention and Behavioral Health Promotion Unit from HHSC to share a little bit more about the suicide prevention and youth substance use prevention and intervention supports that can be accessed by school communities as well.
Okay, thank you so much, Ashton. My name is Jen Meyer. I work with the Prevention and Behavioral Health Promotion Unit, specifically with the HHS State Suicide Prevention Team. And I'm going to kick us off today, talk a little bit about the Prevention and Behavioral Health Promotion Unit, and then talk specifically about suicide prevention. And so this is just kind of a brief overview of what we're going to be talking about. Again, I'm going to just talk briefly about the PBHP program or unit, the suicide prevention program, and then I will pass it off to my colleagues who will talk more about the youth prevention programs, our community coalition partnership program, the Turn 2 campaign, and Texas School Survey. And so just quickly, a little bit about the Prevention and Behavioral Health Promotion Unit. What we do is obviously prevention and behavioral health promotion, but it includes both substance use and suicide prevention programs. So our behavioral health services with HHSC, maybe about 6 months ago or so, did a realignment, and we decided to align our suicide prevention and substance use prevention programs. And the reason is that we believe that there's a strong connection between the missions of both substance use prevention and suicide prevention. And we believe that prevention and treating substance use does prevent suicides. And so the three programs that fall under this unit are suicide prevention, our prevention and educational programs, and promotions and public awareness. So like I said, I'm going to talk about suicide prevention. So really what our suicide prevention program does is it just works to reduce suicide throughout the state of Texas. And so our program shares tools for screening and assessing suicide risk. We analyze suicide data and trends. We're very fortunate that we have an epidemiologist on our team, and she does a wonderful job in helping us analyze that suicide data and helping us stay knowledgeable on the most recent trends, within that data. And we also provide training and technical assistance for best practices for suicide prevention, intervention, and postvention. And I'm sure everyone here is familiar with prevention and intervention. If you have not heard the term postvention before, postvention are really those efforts of support and resources that are provided to individuals who have lost loved ones to suicide. So I'm gonna talk a little bit, or just kind of highlight kind of the main things that we do with the suicide prevention team. And I'm going to start us off by talking about the Suicide Care Initiative. So the Suicide Care Initiative is a mental health block grant funded project that works through those local mental health authorities and local behavioral health authorities that we've been talking about to carry out what we call the Zero Suicide Framework. And the Zero Suicide Framework is just a framework of evidence-based practices with the goal of system-wide transformation and a commitment towards a suicide-safer community. And the foundational belief of zero suicide is that suicide deaths are preventable, and particularly within behavioral health care systems. And so what the Suicide Care Initiative looks like in our state, if you can go to the next slide, please, is that we have this initiative created 4 regional suicide support care centers, which are LMHAs that serve as pilot sites for that zero suicide. And so the 4 RSCCs are the Harris Center, Integral Care, My Health, My Resources of Tarrant County, and Tropical Texas Behavioral Health. And what these regional suicide support centers do is they oversee the development, implementation, and evaluation of that suicide safer care, both within their agencies as well as the other LMHAs and LBHAs that are in their region. One thing that I want to kind of point out from this initiative, or just an example of some of the work that they do, is that training that we're talking about. And so I know John Dell and her team talked some about that youth mental health first aid and mental health first aid. Those that we do have, there are trainers at the LMHAs as well as trainers in some of the trainings that I'm going to talk about in a little bit that our team help facilitate as well, that they can come and help provide suicide prevention trainings, mental health trainings, et cetera, to community partners and to the schools. Okay, next slide, please. So before I talk about those trainings, I just want to talk a little bit about some of the suicide prevention resources that we provide and have developed for the community. We often get asked questions like, how does someone, how do I identify, how do I know someone is suicidal, right? What are some of those risk factors? How can I ask someone about suicide? How can I help someone help get them the help that they need? And so we created several one-pagers that are on our website, and I'll post our website in the chat as well as our group email once I'm done with my little spiel here. But what we wanted to highlight today is some of those youth suicide specific one-pagers that we have related to suicide prevention. And these are free on our website. You can download, print them, feel free to share them electronically. Obviously the links are on the slides, but we have, as you can see here, we have a youth suicide prevention resource guide or resource page. We have a wallet card specifically for parents for youth suicide prevention. We have some post-vention information. The next slide lists some of our special population resources. So we have one for IDD. And if you can move to the next slide, please. So we have one for individuals that are diagnosed with individuals with intellectual and developmental disabilities. We have a one-pager that is specific for teachers, and we also have some information for youth that are involved with the justice system. We also have some links for some other resources that talk about risk factors, our 988 suicide and crisis hotline, warning signs, et cetera, and those all can be found on our website. Okay, so I want to talk also about trainings. And so some of you are probably familiar with the trainings that we offer. This is a big part of what we do within our team, as well as we help facilitate with the local mental health authorities. Again, because the local mental health authorities also have trainers in many of these trainings. And so we try to help community partners or help schools coordinate or collaborate with those local mental health authorities for that professional development and for those trainings. And so I'm not going to talk about every single one of these trainings just for time's sake, but I'm going to highlight a few that I think are very helpful for schools as well as parents and families and other community members. The ones that you may be most familiar with are our Ask About Suicide to Save a Life and our Safety Planning Intervention trainings. So our Ask About Suicide to Save a Life is that 3-hour virtual or in-person training that covers suicide data. We talk about risk factors, protective factors, and it also teaches individuals how to talk about suicide and ask about suicide. And our safety planning intervention is a 4-hour virtual or in-person training that teaches safety planning for someone at risk for suicide. Those are probably the most common ones that we do, particularly within the schools or within the community. We also periodically offer train the trainers for both ask and safety planning. And we try to, obviously, get that information out as quickly as we can once we know when we're going to be doing those trainings. But again, the local mental health authorities also have trainers also have trainers that can teach these same trainings. And so we try to collaborate or try to help facilitate that collaboration as much as possible. We also recently started doing a crisis risk assessment training. This is actually a 2-day virtual training, but it does help teach mental health providers specifically on how to complete a comprehensive risk assessment. And then on the next slide, the couple others that I just want to mention are, some people may not be aware that we also provide a postvention in schools training. This helps teach a healthy grieving from suicide loss. And I know, unfortunately, many schools have experienced suicide loss, whether that's been, among the student population or faculty or other school staff. So we can do that training if any schools are interested. Also, when, sometimes we get asked, how can we provide trainings for parents or family members? Our suicide care in Texas is a briefer training. It's about an hour and a half. We can do that virtually as well, but it's an overview of just suicide prevention, intervention, and postvention support, and what that looks like throughout the state of Texas. And so it's kind of more of an informative training, but it can be useful for those individuals that are maybe trying to understand or learn how to navigate what suicide care looks like in Texas. And again, I will post our group email and our website. If you are interested in those trainings, you can certainly email us and to get more information or any other resources or technical assistance that we might be able to provide. You can also reach out to us. And that is pretty much, I do have a slide on mental health first aid. I think John Dell did a really great job of talking about youth mental health, kind of what we can provide, what HHSC can provide. Our team specifically can help facilitate with the local mental health authorities, particularly with the schools, to help you. I know there's sometimes people ask, will reach out to us looking for those trainers because they are lacking trainers in their area or they're having difficulty finding those trainers. Our team can help facilitate that as well. That's pretty much it on suicide prevention. I'm going to go ahead and pass it off to my colleague, Ricardo, and he's going to talk about youth prevention programs.
Thank you, Jen. My name is Ricardo Alaman. I'm the Associate Director for our Youth Prevention and Educational Programs. And so I'm just going to briefly talk a little bit about our YP programs. We are currently in all 11 regions, HHSC regions here in Texas. We cover a majority of the counties in those regions. Our programs utilize an evidence-based strategy called our prevention framework. It's our strategic prevention framework. We also use our 6 CSAP strategies in our youth prevention programs, which is information dissemination, providing education. We do positive alternatives, and we also do problem ID and referrals with the folks that we're working with. The curriculums that we use with our youth prevention programs include the Blues program, our curriculum-based support groups, Learning to Breathe, life skills training, positive action, and we also incorporate 2 family-focused programs, which is Guiding Good Choices and Strengthening Families. The family-focused programs brings the adults and the youth together to go through these curriculums that we have. Our curriculums are implemented in 3 different populations of focus. The first one that you see here is our Youth Prevention Universal, which focuses on the general population. Our Youth Prevention Selective, which focus on subgroups of the general population. And our Youth Prevention Indicated, which focus on people that are in high-risk environments. I will turn it over now to my colleague, Claire Jameson, to talk about the rest of our youth prevention programs.
Hi, everyone. I am going to do an overview of a few of our more environmental level prevention programs. My name is Claire Jamison. I'm the one of the other associate directors in prevention and behavioral health promotion, and my team oversees more of our environmental level prevention programs. So kind of zooming out and looking at what we're doing on the community or the state level. So the first program I'm going to talk about are our Community Coalition Partnership Program. So we fund organizations across the state to create coalitions in communities to address substance use on the community level. So as Ricardo mentioned, our programs also use the strategic prevention framework, which is SAMHSA's framework for kind of implementing evidence-based change in communities to address substance use. And so these coalitions, I think right now we have 42 across the state. They'll look at their community and they'll see kind of what they'll do an environmental scan of the community, see what substance use looks like in the community, and then work with their different coalition members, which is a group of, the sectors of the community that would be interested in substance use prevention. So we're looking at schools, law enforcement, Chamber of Commerce, hospitals, just kind of youth, parents, just kind of the whole community, seeing what different changes we can make. And so these environmental strategies are really looking at changing policies and influencing social norms. A good example of an environmental policy that I know a lot of our coalitions have worked on are smoke-free policies. So many people may not know that statewide, we don't have a law prohibiting indoor use of like cigarettes or other tobacco products. So one example of an environmental strategy is that our coalitions can work, on a municipal level with their decision makers to help them pass a comprehensive smoke-free ordinance so that they can, prevent indoor use of tobacco, which works on one, changing policies and also changing norms regarding using tobacco use in the community. Another example could be one of our coalitions could, during their needs assessment and community scan, could see a place that, previously was a park, has fallen into disrepair, and maybe is a place where a lot of people go to use substances. Something they could do is they could work with the community to kind of transform that space. And instead of being a place where people goes to use substances, it could become a place where the community gathers for celebrations, or a park, or a place where people could do those alternative activities that Ricardo mentioned in his presentation. So we do have a list of all of our currently funded coalitions and also our youth prevention programs on one of our websites, and I can put that website in the chat after this, but it's texaspreventiontraining.org. It has a map of all of our providers, substance use prevention providers across the state, but there definitely are coalitions in your community if you or your school want to get involved. We also do, we do have one school district, Clear Creek ISD, and they have a coalition out of their school district. So there are definitely lots of ways that schools can get involved in the community to prevent substance use. The next thing I'm going to talk about is our statewide media campaign. So in the past, our prevention program has done a lot of media to kind of educate the public on the dangers of substance use. And while that is important, I do think that a majority of us know that substances are dangerous. And so in an effort to kind of move substance use prevention more upstream and address the risk and protective factors, or address mostly the risk factors that cause substance use, we created this campaign called Turn 2. And Turn 2 is funded by those COVID dollars we got from the federal government. And really Turn 2 is kind of really promoting people to, instead of turning to substance uses to address their emotions, to turning to either a person or a resource in their community if they're having those feelings they need to address, or if they have any, underlying mental health issues that they would like addressed. So right now we're in our third year of the Turn 2 campaign. We are about to do a big media buy at the end of March. And previously, the Turn 2 campaign had focused on adults, community leaders, and the general public to kind of educate them on, that people may be struggling, that if you are struggling, you can turn to somebody to talk about that. Or if you see someone in your life that's struggling, make yourself available so they can turn to you to talk about their struggles, and so you can provide help. We have a lot of resources on our website, turn2supportstx.org. I'll kind of go over some of those resources on the next slide, but I'm really excited to talk about the next iteration of our campaign for this fiscal year. We're going to be doing more outreach to those adults that work with youth. So teachers, school counselors, community leaders that work with youth. We're really doing a big ad push, and our messaging is really geared towards them. As you can see, we have one of our ads on the screen right there, turn to family and friends for support. We also created a variety of resources aimed at this population. And one of those are these conversation cards that I have on screen. It's a deck, and these will be available on our website. In the future, we're still working on getting them uploaded, but we have like a deck of conversation cards that have different prompts you can read. And they're all like positive, but also kind of help direct the conversation towards, what would you tell a friend if they were sad? What's something you're proud of? What's something you could do today to make tomorrow better? Or what's something you can think of in the morning to like have a positive day? So it's positive, different messages like that. So we're hoping that could be a tool for people to use working with youth. So like I said, our ads will be coming out in March. Very excited about that. You should be seeing them soon. And since y'all are really our target audience here, you may see those ads come up on your social, or, you may see them on billboards or on buses. The next slide just kind of goes over our different resources we have that are aimed at or could be helpful for y'all. And we also have one of our bookmarks that kind of goes over the different emojis that have the different feelings. And so this bookmark will also be available on our website. It's still being uploaded. That's why these two don't have links. But here are some resources that are all hyperlinked to our website that I think could be helpful for y'all. And you'll be able to click on these and see them after when y'all receive the slides. So that's kind of my quick overview of Turn 2. If you have any questions, feel free to email me. I can put my email in the chat. The last thing I'm going to go over is our Texas School Survey. And really the reason I wanted to talk about this during this call is it's really a plug to promote participation. So the Texas School Survey of drug and alcohol use is something that the state has been funding since 1998. And we work with Texas A&M, and they do a random selection of schools, and they go to school administrators and ask if they'll participate in the school survey. Schools that are randomly selected for the statewide sample receive a monetary incentive and survey materials for free. Those schools are also able, instead of getting a monetary support, to get a campus level or a district level report. So you can request a report so you can see kind of the substance use on your campus or at the district level. The reason this survey is incredibly important to us is it really helps us at the statewide level figure out what's going on at the community level, how we need to direct resources, and also look at, emerging substance use trends. We're working on making some adjustments to our future survey to kind of dig down a little more into marijuana use around the state, because that's something that we're looking at. But I do feel like this is a really important survey that we rely on. So we really need the school's help in participating, because we need like the most accurate data so that we can know how to best allocate our resources across the state. That's my last slide, so I'll go ahead and stop sharing my screen. Here are the 2 public email inboxes that we have. I know Jen mentioned, here's the suicide prevention inbox, and then here's our just general substance use prevention inbox. And I think Ricardo also put our information in the chats.
Awesome. Thank you so much. Thank you so much to that HHSC team. Some phenomenal resources and implementation strategies that were shared related to suicide prevention and substance misuse prevention as well. Ricardo, we had a few folks in the chat that just wanted to learn a little bit more about the youth prevention programs. I know we kind of got towards the end of the session there and kind of had to speed up a bit. But before I ask you that question, Tammy, I'm gonna go ahead and ask you to put the survey of QR code and link and all that good stuff in the chat. I'm sorry, up on the screen. We also put it in the chat. We'll have our Q&A discussion, but as folks are kind of listening in, we do want to encourage you all to use to go ahead and open up that link and complete the post-session survey. So yeah, going back to you, Mr. Ricardo, can you talk a little bit more about those evidence-based programs that through the YP program that you have, and then also if a school district wanted to bring in some of those evidence-based programs or utilize those resources, what are some like good steps or considerations? And I know I've asked this before in other meetings to you, but even like cost considerations as well.
Yeah, definitely. Thank you. So our evidence-based curriculas that we use are researched curriculas that have been gone through, several levels of research, and so we know that they definitely work with our youth. So our curriculas really focus on addressing more health than the old way we used to do prevention. We used to do prevention as don't do drugs. Drugs are bad. The egg in the frying pan thing. How we address substance use prevention now is we talk about eating healthy. We talk about taking care of your body. We talk about how important exercise is. We also talk about, or the curriculums talk about, the importance of getting an education or the importance of learning and really working on your mind. So it addresses it from a more health perspective as opposed to what we used to do in the past. The programs that are out in the community or our providers that are providing these curriculums in the community, if you're wanting to bring some of them into your schools, we have a link at our Texas Prevention Training website that has a directory. So you're able to go into that directory and filter out which providers provide services in the region that you're in and even in the counties that you're in. So you would just connect with one of our providers to be able to bring them into your school. If you're not able to find the provider through the map or the directory that we have, you can always reach out to Claire Jameson or myself, and we can get you connected with your local prevention provider.
And I think the last piece of that too, any cost considerations districts might need to consider if they want to bring in some of those providers and provide the curriculum interventions that you mentioned.
Yeah, no, there is absolutely no cost for our providers to go in and provide this service to your schools. We fund them at 100%. So they're able to go in without charging any fees or anything like that. So a great resource for you all that really has some really good benefits. So I encourage you to reach out so we can get some of those curriculums in your schools.
I love that. And I'm more than sure a lot of the school leaders on our call today love to hear it. It's no charge to you. Just reach out to us, and it's really about working through the logistics and making the time for it. And I think that was a big reason why we wanted you all to join us today. Our final question, and again, I want to remind everybody to complete this post training survey as you kind of listen in. But the last question is for you, Jen and Claire. Y'all mentioned a bit around some of the promotion and suicide prevention strategies that you all can provide, not only for like the campus-based staff, but also for the community as well that those schools are serving. And so can y'all talk just a little bit about some of the strategies that might be helpful for schools to consider if they are looking to bring in some of those trainings that you mentioned, or some of the prevention resources that you mentioned, not just for their school staff, but for the community at large?
Yeah, I mean, I can talk a little bit about the suicide prevention piece. I mean, you're probably hearing this kind of a theme for us all and all the HHSC programs, but really utilizing that collaboration with your local mental health authority and developing kind of a relationship with them for that professional development piece. They can, they also provide trainings in the community to the schools. So collaborating with them to be able to offer different trainings like ASK, particularly ASK for parents and families can be very, very useful. The team itself can provide those trainings for families and the community as a whole. For schools in particular, if you're thinking about the multi-tiered system of support, right, that at that tier 1 level, right, really being able to, again, bring in, utilizing those LMHAs and even some of those other community partners to bring in some of those it doesn't even have to be just suicide prevention, but some of that kind of prevention programming and, offering that to families and parents and even youth. But I think your best strategy is really collaborating with those community partners, and we can certainly help facilitate that to just enhance those opportunities that can be offered. And Claire may have something to add to that.
I just quickly add on, as I mentioned, we have fund coalitions across the state. So, if you're interested in getting involved at that level, coalition membership is always a great way for that. I know they love to have representation from the schools. And so I'm sure any of our coalitions would be happy to work with y'all. Additionally, all the Turn To resources we have on our website are free. We have a social media toolkit. We have all the resources. If you want to distribute like some of the printed Turn To materials, you can order those through HHSC for free as well. And while Turn To isn't necessarily educating on the dangers of substance use, it's promoting those positive mental health messages. We also have posters on our website. So there's a lot of Turn To resources, and those are all free for people across the state.
Awesome. Well, I want to just say thank you to the whole Texas Health and Human Services Commission team for joining us today. I think Tammy might have already mentioned in the chat that we went a bit past over 12:30, and folks are still staying on. And so you all did a phenomenal job, and especially just showcasing some of those resources that are either free or at very little to no cost for our school districts to access. I think it's a really good way to show that there are state supports for school-based mental health out there, and it's just really about us collaborating, like you mentioned, Jen, to access those supports. So I'll pass it over to Tammy to close us out, but again, I just want to say thank you to the Texas Health and Human Services Commission.
Excellent. Thank you, Ashton, and thank you everyone for attending. As you see in the chat, there is a link to the post-training survey. If you will please complete that. As a reminder, the recording and the accompanying resources for the session will be posted on our schoolmentalhealthtx.org website. Additionally, you can subscribe to the TEA Mental and Behavioral Health newsletter by using the link that's going to be in the chat, and you can also find it on the website. You can select other TEA topics of interest, and then you'll be able to continue to get more information information and updates as things roll out through our team. For those of you that attended the whole session, CPE certificates will be emailed to the email address you registered with within 1 week. We really thank you for joining our session today, and a huge thank you to our amazing HHSC presenters, and have a great day.
Thank you, everyone.